Yep, we are live.
Sai sir, kindly text me in WhatsApp when we get sufficient number of audience.
Right now.
Uh, so we are live, but let the audience join as well.
No issues, no issues. So I'll get the number of audience who are attending right now.
Uh,
No,
no,
on
sir, I
WhatsApp
don't.
you said, no? Okay, fine, fine, no issues.
இதெல்லாம் எவனுமே ஜாயின் பண்ணல. ஒரு சோகமா இருக்குடா. சோகத்துண்டே இருக்கியா? பண்ணிட்டேன். எவனுமே ஜாயின் பண்ணலையா? ஒருத்தரே ஒருத்தர் நானே.
Six people have joined. We'll wait for 5 more minutes. And let's see.
Okay, no problems.
19. ஹரி இட்ஸ் ஆன் யூடியூப் மெசேஜ் போடு சாட்டுக்கு. ஹரி கிருஷ்ணா வெங்கட சுப்பரமணி. இருக்கு. பேசுறது யூடியூப்ல கேட்க.
So we'll start at 18:35 hours. Is it okay?
Yeah, fine, no issues. It's going live on YouTube also.
So more than 45 people have joined. So shall we start?
Please, all yours.
All right. So good evening, everyone present here. Today, I would like to thank you all for joining us today for this very special session. I'm Anshu Antony from GAIMS, Mauritius, and I would like to introduce to you our guest speaker, veteran Colonel Dr. Ashish Sharma, who has spent more than 30 years in this service as an army doctor. Sir, over to you.
Hi, Anshu. Thanks for inviting me over for this session. At the very outset, good evening to all of you and Jai Hind. And it's a very proud day today, not only because I've been invited here, but the reason that we've launched the Chandrayaan 3, and hopefully in about 40 odd days, we'll be doing a soft landing on the surface of the moon. And of
Of
course,
course.
our contingents are present in Paris today for that famous parade.
This
So
will
it's
be
it's a
very
very
impressive.
proud day today. Yeah. So my compliments, congratulations, not only to all of you, but to the entire nation.
So, sir, many audience have asked, like, they're very curious about how a army doctor lives. What is his life? So what was your reason to join the army, and what motivated you?
You see, the motivations were plenty, but one singular motivation, I'll not discuss that specific one right now. But yes, the life looked very nice. It was very nice, though full of challenges. And yeah, the craze of being known as an FMCite, going to FMC as a student and then passing out from there. The craze is still there, and in our times also the craze was there. So that was also one of the main motivations. And in our days, I think that time we used to have 105 boys and 25 odd girls um, who were taken in as a batch every year. And all the 105 boys used to be permanent commission. So that means that after they passed out from FMC, they were supposed to join the army, navy, or air force, whatever they got, because ultimately it's a tri-service organization, the AMC, that is, because as you progress in your career, many a times people change their uniforms. By changing of uniforms, I mean not on a daily basis. A person who's in the army may go to the navy or perhaps the air force and vice versa. So that's how it is. So that's the reason it is called a tri-services organization. So again, I'm going on a tangent. Um, yeah, so all the 105 boys were supposed to join the army as permanent commission officers. Five of the girls of the 25 were supposed to join as permanent commission officers, and 20 of them were supposed to join as short service commission officers. Of course, there was a clause where you could cough out some money and pay out. Some people did that, and all of them are doing very well. Most of them are in the States, some are in the in UK, and most of them they paid out just to enhance their careers somewhere else outside the country. So yeah, so that basically was the reason I joined FMC, and of course, being a permanent commission cadet that time, I then joined the army. Yeah.
So how is life of a normal medical student, just like us and other, is different from that of an AFMCI?
Um, well, right now, I think it's a little too late to describe the life of an FMCI to you, but yes, it's a little different, but generally the same. When we came in, a few changes were brought in, wherein we were earlier medical students, then we became medical cadets. Free rations came in, and so many things, including some restrictions, also they were put on. So yeah, it's quite different.
All right, sir. So what makes the army doctor special from rest of the doctors? Like, what are the challenges we are seeing?
Uh, you see, I've worked in the army for a pretty long time, and After that, I was a senior consultant with the Tata Main Hospital in Jamshedpur. The life of a doctor, as far as the challenges are concerned, is generally the same. Generally the same, I mean, as far as the profession is concerned, medical profession, that is. Uh, Especially the specialists who are into fields which are full of emergencies, they don't have any respite. For them, the challenges the challenges they pour in day and night. But the
Okay.
fact remains that whatever the challenge is, the body generates that typical adrenaline surge, whether it's an emergency in the OT or an emergency in the field. So that adrenaline surge is what everyone looks for, especially the surgeons and especially the people who are concerned uh, with with emergencies. I'm not saying that others are not. I'm talking about surgical emergencies. Anesthesiologists, they are always on their toes. So all these specialities are always full of challenges. The addition of being an army officer is an added challenge to the doctor's life. Now, therein, there are challenges like you are posted to a very remote area. You are posted many a times to a place where only you are there in the sense out of your family, only you are there. And yeah, so the separations and the moves every 3 years when you go on postings, they have their own challenges. Now some people they really like those challenges. Some people they do join with an idea, yes, that they really like the way the army life is, whatever has been seen, whatever has been perceived, that is. So on that perception they join, and sometimes they don't they are a little disgruntled that yes, no, this was not quite my cup of tea. So it's a mixed bag, but generally people who are motivated, for them it's amazing.
So, from your personal perspective, how did you used to manage your stress?
How did I used to manage my stress?
Yes, sir.
Yeah, you see, stress is always there. When you go for your class in the morning, the stress is you have to reach there, especially if it's my class, you have to reach there on time, otherwise you'll be kicked out. That's one kind of stress, right? Then another stress is the transport has to be there on time so that you are fetched and you are delivered to the mess. You have your breakfast and then you rush to the class. So every kind of stress is there. Now it totally depends on person to person how they deal with it. Now, the moment you agree to understand that this stress is part of the game, you don't make stress an external thing. That means, oh, where did it come from? You say, okay, it's part of the game, it's part of the job. Then stress does not remain a stress, then it becomes part of the job, right? And a little bit of stress is required. Now I am sure you must have finished your first MBBS. So tell
Yes,
me,
sir.
and I'm sure the people who are listening to this podcast or whatever we can call it, whenever they were preparing for their exams, wasn't there stress? Stress has always
Yes, sir.
been
That
there.
was
If you don't have
always.
stress, you'll not work. But stress should not overpower you. Stress is what brings the adrenaline out. Stress is what makes you operate beautifully in an emergency situation, right? So stress is required, but stress should not overpower you. That's the main idea. Now if you have leanings towards reading some fiction, there was an author called Alistair MacLean. I'm sure people must have read his books and novels, very nice pacey books. He wrote a very nice piece called if you get time, just go through it. It's called Fear is the Key. That's the name of that novel, wherein it's very nice. You see, the way he's described it, he uses fear to attain his goals, not his own fear, but others' fears. So that's the idea. You use the stress, and by using the stress, I mean you have to get used to the stressful situations. If you are not used to getting used to stressful situations, stress will overpower you. So it's a zero sum game. One has to win. Now it depends how much do you want to win. It's your willingness to win,
Yes, sir. So talking about
not too
specialists,
much of
which
I believe. Yeah.
so talking about specialists, which specialty did you pursue?
Oh, the chance of doing a specialty, especially in India and in the army, is just one chance you get. One chance in the that means once you've done a specialty, yeah, that's it. You are that particular specialist. Yes, if you are offered a specialty and you refuse, then next year you have to appear for an exam. In our days, the exam used to be held in within the precincts of AMC. So next year again you appear, and if you are able to secure a good rank, then you can have your specialty of choice. That's what it is. But I'll be very frank. The moment I left MBBS, that is, I finished MBBS, I actually had no idea which specialty I wanted. Actually, I started my internship, and the very first attachment of mine was with the gynae department. And to my good fortune, there was a gentleman, Colonel Bablani, I still remember his name, excellent surgeon, excellent gynecologist, and he gave me so much of chance. By chance, I mean he in the OT, he said, "You do. I'm standing beside you. You do." Just as an intern. People usually don't do that, and that brought me into the likings of being a surgeon. I really liked handling the tissue and all those things. So over a period of time, as I grew in my career, that liking became a little more focused. I wanted to do something with my hands, something which was related to surgery. And then again, things like I wanted to do something with a microscope. I wanted to drill the bone also. I wanted to do some bone work, everything. So ultimately, when I appeared for my postgraduate entrance test, I was fortunate to secure a good place. And yeah, then I chose ENT because herein you do everything endoscopically, you drill bones, everything. I'm not being partial to my specialty, but I really enjoyed my specialty.
So what was your most memorable moment in the army?
My first jump. That's an
Can
answer
you
for you.
describe it if
Others can
possible?
understand. Yeah.
Okay, sir. So how is your life after retirement?
It's as good or as bad, whatever you can call it. I'm enjoying every moment of it.
Do
It's
you
how
miss
you
being in
take
the
it. You
army?
see, there are people when they leave the army, um, they go into a state of mind where they say, "Oh, now that I've left the army, everything is gone." But you have to reinvent yourself. Primarily, we are all doctors. You are going to be doctors. You are the next generation. You are the future of the profession. So that skill, what we in Hindi call hunar, that does not go away. It's with you. Now it totally depends on you how you are going to exploit it. And if you enjoy your work in the army, outside the army, anywhere, you'll always have a wonderful time. That is if you enjoy your work.
Indeed.
Now, right now,
So
I
what are the
enjoy teaching, so I'm having a wonderful time.
so do you miss being in the army?
Oh yeah, it's not missing, but I do have very fond memories. There's a distinct difference. I have very fond memories of my comrades in arms, of my friends, buddies, and the things that we've done together. Uh, there's never been a dull moment. But then yes, that is a phase which is there now. People like you who are attending the seminars, aspiring, I'm sure it's not only out of curiosity that people are attending this seminar. They are aspiring to be medicos in the army. So army, air force, navy, whatever their choice is. So yeah, so I'm not missing it, but I've had very fond memories. Everyone moves on, life moves on. One knows what is born has to go one day. So it's a phase of life. You have to adapt to the changes. I could run a 5 kilometers in 18 minutes when I was about 25, 26. Now I do it in 21, 22 minutes. Yes, life has taken its course. It's toll. Yeah, it's okay. Part of the game.
So what is that one lesson or the quality that army gave you?
You see, army gives you a lot of lessons. It's what you imbibe, what you
Okay.
pick up. You see, it's a way of life. It's you can't say no. Army did this to me. Army, it's just because of army. I say my personality, my development, my everything, which I have become after 12th. That is after I joined AFMC. It's thanks to the Indian Army, to AFMC, of course, everything. But again, uh, one has to have the willingness to imbibe those things, right? One should not go or get into an analysis kind of a thing, right? This is a thing, no, why it should be that, it should be this, it should be that. Imbibe it, savor it. If you like the taste, fine, digest it, assimilate it. Otherwise, expel it in
So
whatever way.
last but not least, what are the opportunities that you got as an army doctor in terms of adventure, in terms of academics, in terms of your medical profession? What are the opportunities that you got?
Plenty of them. You see, I'll just give you one example. I'll not go into what happened during specialty days, that is post graduation days, what happened during one particular posting, what happened, what kind of cases, and all those things. Uh, I consider myself very lucky in two ways. One, during my post graduation, I got two extremely competent teachers. In fact, all the teachers who were there were extremely competent. And again, like Dr. Bablani, he gave me a free hand. These gentlemen also gave me a free hand. I was in that particular unit, I was the only trainee. We used to have two OT days in a week. I think Thursday and Fridays were the two OT days. And the dictum was, there were two of them. One is yours, one is mine. Rest all is his. His means mine. So in an OT, if there are about 7 cases listed for a day, I used to do 5 cases. So it's not my luck. It's because of their benevolence, right? So it's their benevolence. Again, luck. If I may say so, I got posted to a place. Most of you must have heard of it. There's so many YouTube videos on that. It's a historic place. It's called 92 Base Hospital, and 92 Base Hospital is in Srinagar. And Srinagar has always been. I've spent a lot of time in the valley. One of them is in 92 Base Hospital. One of the tenures, that is. Uh, it's a place which is totally different than any other armed forces hospital. It's always in a perpetual war zone, continuous casualties. And you see, the interesting part is, usually these days the soldier is well taken care of. He's got his bulletproof jacket, he's got a very nice helmet, and all those wares that he has for his protection. But the face, the neck, usually many times these days the body armor also comes with some neck protection also. But this place is mostly bereft of any particular let's say protection. And me being the only ENT and head and neck surgeon in 92 base hospital, for 3 years I had my hands full. I There were times when I used to operate for 36 hours, perhaps more. Everything used to be taken care of. The meals used to come to the OT, coffee, everything. We used to take short breaks. Of course, I had help from the general surgeons. Short breaks, start off again. Short breaks, start off again. Of course, by the end of, I'll say even 12 hours, 24 hours, you're totally fagged out, totally. But there is that adrenaline which makes you go, and it keeps you going. Of course, after those hours, after everything is over, then you are gone. For a few hours, even for an entire day, you are gone. And people out there are very considerate. They know what you've been through, the work you've done. If possible, we have saved so many lives. We means it was a team effort. It's not only me. But sometimes you can't. It's again, as I say, part of the game. So it's a lot of satisfaction you get, but then of course there are some setbacks also. No? So that you have to imbibe those setbacks. So what I'm saying is that particular tenure. Besides that, of course, I've had certain other tenures. I'll not discuss it here. Those were very, very nice. But of course, this particular one, as far as my specialty is concerned, very enriching, very, very enriching. And the dividends that I have accrued out of this particular posting have been tremendous.
Okay, sir. So I hope audience got a bit of rough image regarding the army life. Also, I would like sir to address few of the frequently asked questions which I will be presenting right now.
Yeah.
Also regarding the
Yeah, please.
audience, there will be a link sent prior the meeting ends, roughly 10 to 15 minutes before, and I want everyone to fill it so that the certificates can be issued. Thank you.
So you'll read out the questions, Anshu?
Yes, sir.
Okay.
I hope my screen is visible.
Yeah, your screen is visible, but I would rather have you read out the question and then I can answer those. I'm a little far away from the screen. I can hear you, yes, but then I would request you if you could just read out these questions.
Sure, sir.
Yeah.
So one of our participants had asked, can we join the tri services after completing our MBBS as an FMG? And how many vacancies are available?
Absolutely. Yeah. You definitely can. In fact, when I was I'll again cite the example of Srinagar. We had a couple of medical officers who had joined there in Srinagar 92 base hospital as absolute newbies. And if I remember correctly, they had done their MBBS from Ukraine. They had come, they had cleared their FMG, and I was asking them what the procedure was. So yeah, there is absolutely no restriction as far as my latest knowledge is concerned. Now, what happens is over a period of time, rules do change. But I am talking from experience that there have been people from outside, that is, who've done their MBBS from outside the country, cleared their FMG, and they've joined the army. As far as vacancies are concerned, no one can say, no one, right? People even at the very highest levels can't say on a particular day how many vacancies would be there. So there is a compilation at the end of a certain period where they bring out those vacancies, especially for people who are joining from outside. And mind you, all the people who join from outside, by outside I mean who are joining from outside, be it they've cleared their FMG or they are from other medical colleges, uh, all of them are short service commission officers. It's not that they'll never become permanent commission officers, but there is a criteria. There is a time limit after which they can apply, and if they get through, then of course there are. But if you ask me how many vacancies are there, specifically, one can't say. The number keeps varying. How many people have retired? How many people have taken premature retirement? So
So
one
could you
can't
give
say
us
for
a
a certain period.
a rough estimate?
No, I can't. I can't. I can't. You see, it totally depends.
All
Many
right.
a times you can't even say that this is the month when these
Also, I hope
vacancies will be released.
everyone is clear about this fact. Also, I would like the participants to drop some questions on the live chat box. If they have some personal queries, they can put it on the live chat box, and we will try our best to answer all these. Moving on to the next question, sir. How to start the process and what are the eligibility criteria? What's the syllabus of the interview and on what basis the selection is done and what is the interview clearing rate?
Again, I'll answer the last question first. No one knows what the interview clearing rate is. It totally depends on the vacancies, and it's not a must that if the vacancies are there, they will definitely have those many people. Of course, there is a merit list which is formulated, but if the person has not done well, he's not done well, right? Now,
Yes, sir.
selection basis, I'm going backwards chronologically. Selection basis, number one, how you perform in the interview. Number two, how your marks are. So it does matter how you've performed in your MBBS also, right? Syllabus of the interview. Now, syllabus of the interview, I many a times it's a very interesting question. I usually to syllabus I reply there is no syllabus as far as a medico is concerned. One should know everything. But then again, it's a wrong statement of mine that I'm saying one should know everything. One can't know everything. But what they usually ask is the basics. Your basics should be clear. How would you manage the emergencies? Because they are interested in people who can manage emergencies on their own in the field. So, your practical knowledge, your grasp of the subject is the main thing. So, I personally would advise that you should prepare if you're preparing for the interview, besides the other parts of the syllabus, your curriculum, whatever it is, as far as what you've prepared, your list of emergencies which have been prepared should be updated every other day. You should know what emergency is, which emergency is, how would you diagnose that emergency, what are the management protocols you will follow as a first responder. That's very important. So now coming to the eligibility criteria, I think interview things I've clarified. That's how the interview
Yes,
usually
sir.
goes. They ask you very basic questions, um, but I there's just one advice. But before that, I'll talk about the process and eligibility criteria. There, of course, is a definite advertisement. It's properly announced. There are websites. You can just Google it and you'll get it. Eligibility criteria is usually MBBS, and if you are a global graduate who's graduated or done the MBBS course outside the country, then of course you have to clear FMG. And these days, I think it's the what's it next which has come in, yeah. So they
Yes,
have
sir.
to clear that next kind of a thing, and then all the documents are to be submitted, and there's a call letter. There is, and then they call you. So that's what it is. Eligibility criteria, of course, you have to do well in the interview. Now, coming to the advice I was talking about, it's a very generalized advice. I talk about this particular advice to my students also who are preparing for their exams. And it's a very simple thing. You see, when somebody is asking you a question, if you are not sure of it, if you don't know it, just say, sir, excuse me, sir, I'm sorry, sir, I'm not sure about this answer, or I don't know this answer. Be very candid about it. uh, if you keep meandering around, beating around the bush, it doesn't actually pay any dividends. So the idea is that if you don't know the question or the answer to that question, say, sir, I'm sorry, I'm not very sure about it, so that the person who's conducting the interview, or the panel, or the panelists, they can move on to the next question. Otherwise, you'll keep meandering around on the same question about which you don't know about anything. So it's actually it doesn't pay any dividend. Yeah, so that's the long and short of it.
Thank you, sir. So, what is the physical fitness criteria, and what are the opportunities as
You see,
army
there
doctor?
is
I
a
think.
long list, but it's the medical fitness, which basically is the main thing. When you are when you are there for your interview, and of course all the medicals have been done, that of course is one of the criteria. There are laid down criteria. Now if you want, I can share those criteria which I had with me. I think I have to dig in one of the files and bring out those criteria, so all of you can go about it. But they are a little particular about the eyesight. I believe somebody asked me, I had gone through a few questions about 6D problem. As an AFMCite, if you need to join AFMC, it has to be less than 3.5. If you have to join the AMC, it has to be less than 5.5. I, in fact, confirmed it in the afternoon with one of my ophthalmology colleagues who's still there in the army. So he has confirmed it, and he sent me a write up also on that particular thing. So that one question, I think, has been answered by the gentleman whom I contacted in the afternoon. Yeah, as far as the physical fitness is concerned, it is unlike the physical fitness test that is undertaken during the selection process for SSB. It doesn't happen actually. But the physical fitness is built over time during your various courses that you undertake. But yes, you can't be overtly obese. Those things have to be taken care of. Overweight and any excess weight, either you reduce it and reappear for your medicals, or you are unfit. That's it. So you asking about opportunities as an army doctor? What specific opportunities are you talking about? Yeah.
So, like, what are those things that we have to encounter during as a tenure as an army doctor?
You see, the mainstay of your duties is being a doctor. The only thing which changes is the terrain, various terrains. You should know what's so peculiar about that terrain. And of course, you have, especially during your younger days when you just join, you have to move with the troops. So you have to have a basic fitness that you have to keep up with the troops when they are on the move, mental and physical both. As far as other opportunities are concerned, there are plenty of courses that you can do in the army. You can even go to the adventure club and do various activities if you are so inclined. Um, of course, the opportunities for doing the post graduation are there. I'm not sure what is the latest as far as the post graduation entrance test in the army is concerned. I believe, as per the latest information that I have, that it's been combined with the NEET, and thereafter there was again some bifurcation. But yes, that is one opportunity, that being an army doctor, you get an opportunity of doing post graduation is in perhaps one of the most premier institutes, that is AFMC. So that's one of the major opportunities. As far as the postings and transfers are concerned, generally in all the three services, it happens after about 3 years. So one has to get mentally used to it. People many a times, especially during their initial part of careers, they usually are not very attuned to this particular change, but it's part of a serviceman's life. Whatever officer, whatever other rank, whatever JCOs, whatever, they all have to go through this particular thing: postings, transfers. So yeah, I hope I've answered these questions.
Yes, sir. And sir, one of the most interesting question was, can we join without and with PG? And what are the post-grad opportunities in the army?
Yeah, I can't. Yeah, are we online?
Yes, sir. Sorry, I think my network is a bit poor. I would repeat the question. Can we join without and with done post-graduation? And what are the postgraduate opportunities in the army?
No, Anshu, I can't. The audio is not good enough. I can't hear you.
Hello, sir. Am I audible right now? So just a second.
Yeah, so
Hello.
I can read this particular question. I don't know whether my audio is clear to you or not.
So your audio is clear, sir.
Fine. Okay. So the questions which have been put across are: can we join without and with PG? Yes, with PG also people have joined. Without PG, of course, people have joined. But the fact is, without PG, it's a simpler process. Though with PG is also a simpler process. But when you've done your PG, you don't join as specialists. You join as, let's say, if somebody has done his MS in ENT, he'll join as MOENT. He'll not be a specialist ENT. Then he has to undergo an observation under a senior advisor. And then the senior advisor, in his wisdom, if he feels that, yeah, this candidate is enough to be a specialist in the army with all the rigors and everything, yeah, then that person, then he gets a stamp of a graded specialist first. Then you go on to become a classified specialist, then a senior advisor. As far as the postgraduate opportunities in the army are concerned, I think I had amplified on this. It's easier to do a post graduation while being in the army. You get more opportunities. Also, once you've done your post graduation, you get opportunities to do super specialization also. So the the path of your career as a doctor and also as a specialist, if you want to go beyond a simple specialization, is absolutely clear. It totally depends on what you put in. Your effort is required, actually. Yeah, so I hope these two questions are answered.
Sir, one more thing. Are all postgraduate degrees are available in
Yeah.
AFMC? Moving on to the
Yes,
next.
everything. Pardon
All
me.
right. Sorry, sir. Another interesting
Yeah.
question is, how is life as an army officer for a woman doctor?
You see, it's a very tricky question. From the point of view of a lady, I'll not be able to answer. But what I have seen is they have done exceptionally well in every field that they have been dropped into, as far as a woman doctor is concerned, as you so put it. But lady doctors in the army, they have done equally or perhaps many a times much better than their male counterparts. And they have risen through the hierarchy, whatever the doctors have, and that people have retired as lieutenant generals, the ladies, and of course they've done exceptionally well. So all the opportunities are there, and if you're willing, their life is as good as or as tough as that of a male doctor.
So there are no gender bias.
No, of course not. No.
All right. Moving on to the next, that was the myopia of 60. So, are there any
Yeah, this I
medical
think I
class
have addressed
relaxations?
this particular thing I've addressed. It's 5.5 is the limit of relaxation. So even if with correction, no, it's 6 - 6 will not actually work.
So, one more question was like, can people join after
Yes,
doing LASIK surgeries?
after doing,
LASIK surgery, sir.
I didn't get that question, Anju.
So, there's an eye correcting surgeries.
You
So,
see,
can
that's a
uh,
question which basically would be answered by an ophthalmologist who's in the army. But I can get back to you about the latest rule on this because this rule keeps varying. In between, they were accepting. I till the time I was there in the army, they were accepting. If something has changed overnight or over the last couple of years, I'm not sure. But just note down the phone number or the email address of the lady or the gentleman who asked this particular question. I'll by tomorrow I'll get back to you and you can inform them about this particular thing. And if it's okay, you can address the August audience also about the same issue.
sure, sir. Thank you. So, how can we opt for Army, Navy, or Air Force if it's an option for us, or it's based on the tenure?
Yeah, so you see, most of the people, it depends totally on a personal choice. Um, I had batchmates who were die-hard takers for the Navy. They were die-hard takers for the Air Force, and there were people like me who wanted the Army. Now there are many factors. First is the individual factor. There are people who combine where they stay, that is their native places. So, and of course, the postings as far as the Navy and Air Force are concerned, I'm not saying it's not as hard, but the the remoteness of the various places, as far as the comparison is concerned between the Army and Air Force and Navy, is very there is a little difference. So people who go into the Air Force and Navy, they usually are posted to locations which are not as remote. In the army, the locations, especially in the field, are pretty remote. Um as far as how you can make the choice in AFMC when you graduate, I'm talking about AFMC. When you graduate, it totally depends on your merit list. If you are high up on the merit list, you are given a choice. Whichever service you want, you go, because of course army is the largest in number, right? So consequently the vacancies in the army are many more times than Air Force and Navy. So consequently there is much more competition for seats of Air Force and Navy. Similarly, when when the people from outside, that is people who've done their MBBS from abroad or from other colleges in India, when they apply, they get selected. They are given a choice. Okay, these many vacancies in Army, these many vacancies in the Navy, in the Air Force are available. It's your choice, and that choice, of course, over a period of time, depending on the merit list, keeps going down. So if you are on, let's say, the 40th rank, and as far as the merit list is concerned, and you have only Army left, you can't do anything. You have to join the Army. So that's how it is.
All right, sir. So, how did how did you imagine military life before you joined, and how did your perceptions change after serving?
Oh, again, there's some interruption in the audio. Yeah,
How did you
I
imagine
didn't
military
get
life?
the question, Anshu.
Sir, am I audible clear now?
There is some break in the audio. I can't hear you.
Hello, am I audible now?
Yeah, yeah, Anshu. Yes,
So,
I
one
could hear
question
your
was,
hello.
so
Yeah.
how did you imagine military life before you joined, and how did your perceptions change after serving?
I wanted a tough life. The perceptions did not change. I opted for whatever was toughest. And you know the history. So the perceptions never changed. In fact, they got better and better.
All right, sir. So there are a few questions from the YouTube live chat. If you don't mind, can I read them out?
Again, no audio. Yeah, I can't hear you.
Just a second.
No, the audio is breaking again, Anshu. Yeah.
Am I audible now? Hello.
I am not getting any audio, Anshu. I am trying to WhatsApp you about the same. Yeah, now I heard a hello from you.
So there are a few questions from the YouTube live chat. So can
Yeah,
I
again,
read
nothing.
them out? So
I can't. You can WhatsApp me the question in case it's so. If you are able to hear me, then I'll keep talking. And you can, of course, display the question on the screen also.
hello, am I audible?
Yeah, Anshu, I can't hear you. I just can hear some hello once a while. Yeah. I, in fact, have also messaged you. I can't, nothing. I, now, Mr. Hari has written about the hierarchy. If you can hear me, I don't know whether you can hear me or not. If yes, just okay. Yeah, Anshu, can you hear me now? Now?
Yes, sir, I can hear you. Am I audible? Hello.
Mr. Hari had just asked about the hierarchy in the army. It's the same. The rank structure is the same as that in the other branches of the army. The only thing which differs is that as far as AMC is concerned, yeah, Anshu, I can see you now, but I can't hear you.
Am I audible?
Now you are audible. Yes.
All right, sir. Uh, so there were a few questions from
So I
the
was just replying to
YouTube.
Mr. Hari. So he asked me about the hierarchy and he asked me whether there is toxicity. You see, it depends on you what you consider toxic. If you have to be very clear in your goals. You have to be not toxic. Comes your way, ultimately it will become toxic. And the army gives you ample chance to put up your hand and express your view. It's the thing that that you can't speak in the army, that perception is not actually quite true. So you can express your views, but of course there is a way to do it. So that I hope answers your question. Yeah, Anshu, you can now carry on.
So one of the questions was, is there any scope for internship in AFMC for FMG students?
Yeah, I can't hear you. Again, breaking, Anshu.
Uh, am I audible?
Mr. Sai, your audio comes up for just a few seconds and then it goes off.
Am I audible
Bad
now?
weather where, Anshu?
So here in
Now you
Flak.
are audible, yes.
Oh, all right, sir. I
Oh,
hope
in
I can
Flak?
continue.
Okay. Okay, maybe. Fine.
Uh, so one of the questions was, is there any scope for internship in AFMC as FMG graduates? Hello.
Yeah. Yeah, Anshu.
Uh, Sir, I think I will address you the questions. Sai sir will be addressing you the questions. I'll just tell about you.
Anshu, what we can do is you can share what we were talking about in the afternoon about what I was planning to launch, firstly. Secondly, you can share my WhatsApp number and, if possible, the Gmail address also. People who have specific questions, I'll keep answering them. But I am not too good or too punctual with the WhatsApp messages, but rest assured, I will answer all the questions. Um, I think the bad weather out here on this island country has affected the proceedings. So, what do we do, Anshu?
Uh,
Do we call it a day or plan another event someday?
sure, sir. Or else I'll just give you the list of the questions which
If people are
I'm.
interested, I am game, no issues.
It's, yes, sir. People are interested. There's a good number of audience.
Okay.
I think the network is okay now. I think we can continue. Am I properly audible? Sir, am I
Yeah,
audible
of
right?
course. If the video and the audio holds, we can. No issues from my side.
All right, sir. Um, So one of the questions was, is there scope for internship in AFMC for FMG graduates?
For
FMG graduates, FMG students, foreign medical
again, it's gone.
graduates.
Yes, yes. FMG graduates, then what? I couldn't hear the other part of the question.
So is there any scope for internship in AFMC for the foreign medical graduates?
No. Internship usually is not entertained as far as other outside colleges are concerned in the military hospitals.
All right, sir. Another question
One odd
was,
exception may have been there, but usually it is not done.
all right,
Yeah.
sir. Uh, Another question from Vignesh was, good evening, sir. Can anyone join the army with a healed fracture? For example, healed clavicle fracture.
No, I didn't get that question, Anshu.
Sir, can anyone join the army with a healed fracture? Am I audible?
No, I couldn't.
Sir, I will WhatsApp you the question, sir.
There's a major issue, I think, in the connectivity.
Yes, sir. Sir, kindly
The
check the
question, I'll keep
WhatsApp.
speaking. Hopefully, you get something. Okay. So there is a question from Mr. Akash regarding scope of internship. I've answered that. Then Mr. Vignesh says, "Good evening, sir. Can anyone join the army with a healed fracture? For example, a healed clavicle fracture." Now it totally depends, Mr. Vignesh. The fracture, if it's healed properly, the bone has aligned properly, then you have to be referred to the orthopedician, which mostly they do agree, especially as far as the AMC doctors are concerned. They do agree to take you in as a doctor. So I hope I've entertained that particular thing. Then Mr. Shiv Sukun says, how about surgical equipment wise? As far as surgical equipment wise is concerned, in all the centers where the specialities are there, super specialities are there, we are abundantly taken care of. The instruments, the everything is aplenty. Then Mr. Ankit Aman, Anshu will ask chat questions in the end. Yes, Mr. Hari Krishnan, could you elaborate? He's talking to Mr. Shiv. Mr. Arya says, generally perceive that life of an army doctor in terms of ideology and aspects is contrary. Sir, how do you manage to handle such extreme ends? I couldn't quite understand, Mr. Arya, what is contrary. I couldn't quite understand the contrary aspect of the ideology. So if you could just explain it to me, you can WhatsApp me a straight question about that, then I'll be able to respond to that. Uh, then the question is, can trans people join the army? Till now, there are no specific rules on that. I have not seen any trans people joining the army as of now. Mr. Vignesh says, how is the hierarchy? I've answered that question. Mr. Shiv says he can hear. Then there are all comments about the audio. Okay, Anshu. Anything else?
Am I audible now?
I just hope that audio got through.
Yes, sir. Your audio was clear, sir. Am I audible?
Yeah. Okay. So you the audio did get through. Yeah.
Am I audible now? Hello.
Yeah. Yeah.
All right, sir. Sorry, I think because of the broadband, I'm not able to present it properly.
I think
So
it's
I
because
hope,
of the connectivity issues. Yeah.
yes, sir. I hope everyone have cleared their doubts and everything. Now the link will be sent regarding the certificates. And if there's any specific questions to be asked, one can DM or personally text Sir. So Sir is actually going to start a venture regarding the all the FMG preparations, the MBBS guidelines, and SSB for like sorry, it's better if you can speak about it.
Yeah, so my plan, it's still I'm still thinking over it, though the material is quite it's there with me. So I'm planning on, specifically from the ENT point of view, of organizing topics for preparation for your FMG or whatever it is called now, next exam, as far as the MCQs are concerned, explaining it in a way that you remember it, not mugging it up or cramming it up. Then, of course, for people who are exam goers or people who want specific guidance on various topics as far as ENT is concerned, and otherwise also I keep harping on various topics. So I plan to, and what media it will be? Will it be on a YouTube? Will I open up a website and start doing whatever is required? But yes, I plan to organize things in a way wherein all the MBBS students and people who are aspiring for their competitions also can benefit out. So that's what my plan is. It's still not fructified. It's still in the planning stages. As I mentioned, everything is ready with me. I just need to make sure what and how I want to do it. Yeah, so that's it.
All right.
And
I hope.
any queries, specific queries, I'll be too happy to answer on WhatsApp. I'll message you maybe a day later. I can't assure you that immediately I'll message you, but the message will definitely come back.
All right. So thank you for joining us today. I hope this session was really interesting, and I hope we were able to clear all the queries and all the doubts regarding joining the armed forces. And I hope we are able to at least inspire one soul or two soul regarding joining the legendary or the mighty armed forces. With this, I would like to call it a day off. Thank you very much, sir, for joining. One can
Thank you,
contact.
Anshu, and thank you everyone for participating so wholeheartedly. Thank you so much, and have a good evening. You never
You too,
say
sir.
good night.
Thank
Have
you
a
very
good
much, sir.
evening.
Jai Hind, sir.
Bye. Take
Thank you.
care. Jai Hind.
Also, now I would like to thank the James platform for giving us a platform to, organize this event. And I hope we were able to clear everyone's query. If anything, one can definitely reach out in our DMs of Instagram or like personally send messages regarding it. And also, I would like to thank Dr. Abhishek Kashyap, sir. And I will also like to thank Ankit Aman, sir, Director of MESOG. Thank you for giving us the opportunity. And now I would request everyone to fill the forms which have been provided in the description or the live comment section. So I hope it was a really interactive session. If anything, kindly just DM me or anyone from the James fraternity. Thank you and Jai Hind.